So to me, I really, I'm a nurse, so I focus on the fact that they're not getting adequate medical care. We found a child, and the first thing I asked the mom is she up to date on her immunizations? She's only 2, and of course she's not. So, we're working with the family to get them up to date.
Margaret Hattori had just heard about the death of a possibly homeless man in Antigua, and while she didn't claim to know anything about that case, she tells us lack of health care is always a primary suspect. Medical problems can also lead to a person becoming homeless.
Just earlier, one of the households that I surveyed, a gentleman he's a bus driver. He was a bus driver. His wife had a stroke, and she became suicidal. He had to quit his job. Family wasn't supporting. They couldn't watch her. She's paralyzed on one side. But he was working. He was paying his bills.
April and Margaret represent 2 of more than 20 public and private sector groups that canvass Guam each year to get information on Guam's homeless population, which, as of last year, numbered around 1,200. Much of the information comes from the homeless people who April and others speak to while out in the field.
What we tell them is we're here to understand the housing conditions. Some of them don't even have any house. Some of them do have structures that are inadequate. They are exposed to the elements, and we want to understand why they're there, what happened, what brought them to that area, what kind of struggles they're facing, and what we need to do to be able to help people get out of that situation.
While the count itself is fairly similar to last year's, the higher number of volunteers could result in faster data.
So actually we've got, right now it's 4 high school students that have actually volunteered. Some of them have been here since 4 a.m. and they're helping enter the data. And that will hopefully be able to give us a preliminary count by the end of today.
Faster data could mean faster federal assistance, which is a big reason the count takes place. Hattori, dean of UOG's School of Nursing and a longtime count participant, says you don't need compassion to see homelessness hurts all of us.
If you think of the children that are being affected by this cycle, and if we don't get them educated and off the street, it's just going to continue to cause problems. And we're the ones that have to pay for their health care. We're paying for incarceration. We're paying for their medical care, substance abuse issues. So it's just this horrible cycle. And those things affect the middle class. They affect you and I. Because that's our taxpayer dollars going to, to be cold, right? Since you asked.